At Lehigh Valley Health Network, we are passionate about caring for the people of our community, including our children. That's why we partnered with the Allentown School District to make access to health care easier for your children in a program we call TeleHealth. TeleHealth allows doctors and nurses to care for your children while they're in school. Using secure, interactive technology, healthcare professionals can evaluate your children just like they were in the doctor's office, but they remain in school.
We're pleased with the telehealth program that we have in our elementary schools because it permits our students to get the health care they need at the time they need it, and we know it gives our parents and guardians peace of mind. Best of all, it's free to our students, and any of our students can take advantage of it. It's available in 5 of our elementary schools: Central, McKinley, Cleveland, Ramos, and Moser. We're grateful to the Dorothy Ryder Pool Healthcare Trust for providing the funds that support this program.
Before telehealth, when children would get sick, parents would have to take off of work. They would have to come in and pick up their child and arrange a doctor appointment. Often that would mean that families and children would miss 1 to 2 days of school or work until all those things were taken care of. Telehealth changes all that.
As a school nurse, we utilize telehealth technology whenever a student presents with an acute illness, such as a sore throat or an earache. However, we still notify the parents and make them aware of the upcoming visit and provide them the opportunity to come to the school to participate in the telehealth visit because we want them to be involved in their child's care. Utilizing telehealth technology, we present the student to a Lehigh Valley Health Network physician or nurse practitioner who's in a different location for their telehealth visit.
We have special equipment that allows us to look into the child's ears and throat. The doctor can see this at a distance. We also are able to evaluate skin rashes. The special stethoscope allows the doctor to listen to the child's heart and lungs. We are also able to perform a test that evaluates the child for strep throat.
So if a child has strep throat, they can receive point-of-care testing right there from the school nurse. That can help us determine whether or not the child needs antibiotics. If they do need antibiotics, we can electronically prescribe them to the pharmacy of the parent's choice, and the parent can pick it up on the way home from work. It becomes a very convenient service. If they have other ongoing issues that need further management, we refer that child back to the primary care physician. So if a child doesn't need follow-up, they can get right back into the classroom. That's where the child needs to be in the first place.
Angelise woke up with a fever. As soon as I called the nurse told me that she was going to give her a test of strep throat. She gave her her test of strep throat, and they found out right away that she did have strep throat, and they ordered her antibiotic. I came, I picked her up, I got her the antibiotic, and I took her home to rest. It was so convenient for me that they, that day, that it was like 1, 2, 3. They took her, they checked her, and they found out, they got to the bottom of the problem.
Elijah has asthma, and sometimes it gets really bad, and he needs immediate care right away. It makes me feel secure, that my son is okay. There's a doctor always on hand for him, especially with his asthma being so severe. I'm really happy and I'm satisfied, that they have a program like this in the school.
Education and health are very closely linked. It's very difficult to get a good education if you're sick and are not healthy. And likewise, it's very difficult to be healthy if you aren't well educated. So they're very important, they're very well linked, and it's terrific that the Allentown School District and Lehigh Valley Health Network have the telehealth program because it's going to enable a lot of children and families to be able to remain in school and not have to take time off from school, thereby increasing their ability to learn and become healthy at the same time. And the Pool Healthcare Trust is just delighted to be supportive of it, and congratulations to both organizations for this good work.
I feel safe. I know I won't have asthma attacks here. I just feel groovy.